For this project, you will need 4 things: a 2-strand piece of embroidery floss, a blunt embroidery needle, 14 count Aida cloth, and your pattern. To pick up the needle, you will use your non-dominant hand in a tip-to-tip pinch with digits 1 and 2, converting to a 3-jaw chuck pinch including digit 3. You will then pick up the floss with your dominant hand in a tip-to-tip pinch with digits 1 and 2. Bringing the items together will involve bilateral flexion at the elbow joints, bilateral supination at the distal radio-ulnar joint, slight bilateral flexion at the midcarpal joints, and bilateral flexion and supination at the glenohumeral joints. To push the floss through the needle, you will extend your second digit at the DIP and PIP joints. At the same time, your first digit will extend at the IP joint and flex at the MP joint. You will then flex your first digit at the IP joint and your second digit at the DIP and PIP joints to re-grip the floss once it is through the needle. Extend your radiocarpal joint and supinate at the distal radial-ulnar joint to pull through the floss. Extend your second digit at the MCP joint and abduct your first digit at the CMC joint to release the floss. Transfer the needle to the dominant hand by bilaterally flexing at the midcarpal joint and pronating at the distal radio-ulnar joint. Extend the second digit of the hand holding the needle at the MCP joint to allow room for the dominant hand to grip the needle. Apply a 3-jaw chuck pinch with the dominant hand to grasp the needle. Bilaterally supinate the distal radio-ulnar joint to return hands to a neutral position. Reach down to the fabric by externally rotating and flexing at the glenohumeral joint, extending at the elbow joint, supinating at the distal radio-ulnar joint, and adducting at the radiocarpal joint of your non-dominant hand. Apply a lumbrical grip to grasp the fabric. Internally rotate at the glenohumeral joint and flex at the humeral-ulnar and humeral-radial joints to bring the fabric in front of the body. Move your needle towards the middle of the back of the fabric by extending your dominant hand at the elbow joint and internally rotating at the glenohumeral joint to begin stitching at the top right of the O pattern. Flex at the elbow joint to push the needle into the lower left hole of the stitch. Simultaneously extend the second and third digits at the MP and PIP joints and the first digit at the MP joint. External rotation at the glenohumeral joint followed by flexion at the elbow joint and internal rotation at the glenohumeral joint returns the dominant hand to a 3-jaw chuck grasp on the needle on the front side of the fabric. Pull the needle and thread through the fabric by flexing at the elbow joint and externally rotating at the glenohumeral joint. This occurs until there is approximately a 1-inch tail of floss on the back of the fabric. Flip the fabric to observe the amount of thread left in the back by pronating the non-dominant hand at the distal radio-ulnar joint. Secure the tail of the thread by extending the second digit at the DIP and PIP joints to place the digit over the thread. Pull the thread secure by flexing the second digit at the DIP and PIP joints. Supinate the hand at the distal radio-ulnar joint to return the fabric back to the starting position. To rotate the needle, flex the third digit at the DIP and PIP joints while flexing the first digit at the IP joint. Then extend the third digit at the MP joint while sliding the second digit up the needle by flexing the PIP joint. Then replace the third digit to the tip of the needle by extending at the DIP, PIP, and MP joints, and rotate the needle back to the 3-jaw chuck pinch by slightly flexing at the DIP, PIP, and MP joints of the third digit. After rotating the needle, bring it to the upper right hole of the stitch by internally rotating at the glenohumeral joint and extending at the elbow joint. Push the needle through the hole by extending the second digit at the DIP joint, then extend the PIP joints of the third and second digits and the MP joints of the first and second digits. Then return the second digit to neutral and externally rotate the arm at the glenohumeral joint while supinating at the distal radial joint, followed by extension at the elbow joint, internal rotation at the glenohumeral joint, and flexion at the elbow joint to bring the hand to the needle. Apply a 3-jaw chuck pinch and pull the thread through by extending the arm at the elbow joint and externally rotating at the glenohumeral joint. Flip the fabric over by pronating at the distal radial ulnar joint to view the tail of the thread. Push the tail in place by flexing the second digit at the DIP and PIP joints, followed by extending the same joints. Return the second digit back to the lumbrical grip. Flip the fabric back over by supinating at the distal radial ulnar joint and guide the needle to the lower right hole of the stitch. Flex at the elbow joint to push the needle into the hole. Use motions previously described to return the hand to the front of the fabric and pull the thread through the hole. Flip the fabric to make sure the tail is being caught by the loop of thread being pulled through by pronating the non-dominant hand at the distal radial ulnar joint. After pulling the thread taut, flip the fabric back over by supinating at the distal radial ulnar joint. Rotate the needle and bring it to the upper left hole of the stitch. Push the needle through the hole, then pull it through the back of the fabric as explained before. Now you have completed your first stitch. Repeat these steps without securing the tail in a counterclockwise direction around the O. When you begin stitching up the right side of the O, you will need to alternate the hole you begin with to prevent undoing the previous stitch. Complete the T by first stitching horizontally across the top and then vertically. Flip the fabric over by pronating the forearm of the non-dominant hand at the distal radial ulnar joint to view the back of the fabric. Supinate the dominant hand at the distal radial ulnar joint while internally rotating at the glenohumeral joint and flexing at the elbow joint and the mid-carpal joint to bring the tip of the needle directly next to a row of stitches on the back of the fabric. Slide the needle under by internally rotating at the glenohumeral joint. Simultaneous extension of the second and third digits at the PIP and MP joints with first digit MP joint extension releases the needle. Internally rotate at the glenohumeral joint to apply a tip-to-tip pinch with the first and second digits to grasp the needle. Supinate at the distal radial ulnar joint while internally rotating at the glenohumeral joint to pull the thread through. Continue to pull until the thread is released from the eye of the needle, and then your project is complete.